Knock knock. Hi, my name is Peyton. I'm going to be doing a respiratory assessment. I'm a student nurse practitioner. First, I'm just going to wash my hands and put some gloves on. First, I'm going to start by just doing a general assessment of you. I don't notice that you're in any respiratory distress. Your respirations are even and unlabored. I'm just going to count them for 15 seconds, and then I will times that by 4. And that is going to be about 16 respirations per minute. I also note your color is pink. I don't know any cyanosis. Your lips aren't blue or your fingertips aren't blue. Looking straight up, your trachea is midline, no deviation there. I don't know any use of accessory muscles or retraction of your lungs here. And I also don't hear any wheezes as I'm entering the room. So we can move on to your respiratory assessment. Now I'm going to start by inspecting the chest and thorax. So first I'm looking around and I don't notice any masses, lesions, anything abnormal there. It is symmetrical looking at it. And now I'm just going to do your A to P ratio. So I'm first going to have you lift your arm up for me. And I'm just going to take my hands and measure your interior. And I'm going to move that arm down over here and go across laterally for your posterior, and that is equal. So I would say that your interior to posterior is a ratio of 2 to 1. And next we can move on to palpitation. So I'm just going to press my fingers on you and just let me know if there's any tenderness noted anywhere, okay? And then your back.
No.
No tenderness? Okay. Good. And next I'm going to check for chest expansion. So actually I'm going to have you stand up for a minute. And I'm going to have you turn and sit here for me. And then I'm going to have you lean forward. And I'm just going to place my thumbs and hands at the 10th rib. And I'm going to have you take a deep breath in for me. And a deep breath out. And I'm watching my thumbs move apart as he does that. And they do move apart about 2 centimeters. And he has equal chest expansion there. Alright, and next I can move on to tactile fermentus. So I'm just going to have you actually lean forward again. And I'm going to put my hands on you, and I'm just going to have you say 99.
99.
And keep saying that.
99.
Again.
99.
Again.
99.
One more time.
99.
Good. And as I'm doing that, I'm just making sure that in both palms I feel the same intensity and pitch of 99, and I don't know any louder in one side or softer on one side, so it's about equal intensity throughout there. And now I'm going to move on to percussion. So I'm going to lean forward again, and I'm just going to percuss across the chest, going kind of a zigzag. And as I do this, I'm looking for any hyperresonance or hyporesonance, and I'm just making sure that the pitch, lean forward for me, the pitch and intensity is the same throughout, and I don't feel any dullness as I come across. Good. And then I'm going to do the front side of the chest in the same. Good. And it is equal throughout there. All right, and next I'm just going to have you lean forward again, and I'm going to percuss for diaphragmatic excursion. So I'm just going to go down mid-clavicular and come down until I hear dullness. I note there, and then I'm going to keep going until I don't hear any more dullness there. And then I'll do the same on this side. till I hear dullness. Noted there, and then I move down till it goes back there. And that is about 3 centimeters of the diaphragmatic exclusion. All right, and now I can move on to listening. So as I'm listening, I'm just going to have you take a deep breath in and out, and I'm going to listen for a full respiration at each side, and I'm just listening for pitch, intensity, and duration of inspiration and expiration. And I'm going to also make sure I don't know any crackles, rales, wheezes, or bronchi as I'm going and listening for that. So I'm going to take some deep breaths. And on the right side, I'm just going to go into the right lower lobe. Good. And as I was listening in the vestibular lobes, I did note that the pitch was very soft and the intensity was low. The inspiration to expiration ratio was about the same. And then when I went to the bronchial lobes, I did note that they were a little more louder and harsher, and the expiration was louder than the inspiration. And then when I moved to the vestibular bronchial lobes, I did note that the pitch and chorus were about in the middle of those intermediate, and the inspiration and expiration ratio were about the same. And I don't know any crackles, wheezes, or bronchi listening to those. So next I'll just listen on the front side. You take deep breaths for me. And I'm just listening for the same. Again, on the right side, I'm going to go to the right lower lobe. Good. All right, now I'm going to do the post-tussive test. So I'm just going to listen while you take a bunch of big coughs, okay? So go ahead and cough a bunch for me. Good. Good. And I just hear normal coughing there. I don't hear any crackles or wheezes listening there. All right, next I'm going to perform the voice test. So in the front, I'm just going to have you say 99.
99.
Okay.
99.
Good. And I note that the intensity is the same as I'm saying, and I hear that the same throughout. All right, and lean forward again. And now I'm just going to have you say E.
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 E. E. E. E. E.
Good. And there I did not notice that the E went to an A at all. They sounded the same intensity throughout again. And lastly, I'm just going to do the whisper test. So I'm just going to have you whisper. 1, 2, 3, 4. Good. And I slowly hear the 1, 2, 3, 4. And that just measures the bronography, ethnography, and the whisper test to make sure those all sound